Hello, I'm Dr. Bryan Haas. For many years now, I've specialized in spinal rejuvenation therapy and brain-based therapy. The spinal rejuvenation therapy that we use in our office was developed and originated by Dr. Burl Pettibon. See, his spinal rejuvenation program specializes and utilizes non-surgical spinal decompression. Spinal rejuvenation therapy has been proven clinically for correcting severe spinal conditions. Everything from chronic neck pain to chronic lower back pain, sciatica. We have patients that come in that have a spinal stenosis, and a big part of our office is the patients that come in, they have disc injuries, disc problems, disc herniations in both the neck and the lower back. Our therapies are very effective as well in treating postural problems as well as scoliosis. Today I'd like to speak to you about neck pain. You see, folks, neck pain affects millions of people across the United States, for the world for that matter. It can start in the neck and it can radiate down into the shoulder, down into the arms. It can even run all the way down to the hands and the fingers. And in severe cases, it can be, there can be numbness or tingling, burning sensation in the hands, fingers, or even down the entire arm in severe cases. And as well, some people might lose their grip strength. They may tend to drop things. That's because the nerves in the neck are being pinched or irritated. There could be a disc problem in that area causing weakness or weakness in the hands and the grip strength. So you might have a tendency to drop things. See, it's a chronic condition, folks, and it can be very, very painful. It can be extremely painful for that matter. And that neck pain can be caused by irritation. The irritation, inflammation in the nerves, injury, infection, the pain in the neck, shoulder, arms, and or head. There can be radiating pain up to the head as well with the neck injury or neck problem. Most frequently results from pressure on the nerve roots, the nerves that come off the cervical spine here from the vertebra that shift out of alignment. The bones will actually shift out of place. Those bones, when they shift, will press on those nerves. A disc herniation can cause pressure on those nerves, improper biomechanics of the cervical spine. This comes about due to poor posture, old injuries, especially car accidents, whiplash injuries, sports injuries, and that can cause severe trauma and pressure in to the neck, in the upper back, the neck area, especially whiplash injuries and car accidents. Falls are also pretty common injuries. I see those quite a bit in our office as well, injuring the neck. You see, if you're unhealthy or you have poor posture where the spine, where your shoulders are dropped forward and head is shifted forward there, or an old injuries occurred to your head or neck area there, or to the upper back, you may have lost some of the curve to the spine. And that's the thing I want to demonstrate. Let me grab my spine here. When you lose the curve to your spine, and if you're standing here like this, there's supposed to be a nice normal curve to the spine. If you start to lose the curve, the head will start to shift forward, the spine will actually start to straighten out. When it starts to straighten out like that, it puts tremendous stress and strain in both the neck and the upper back area. These nerves, these little yellow things right here, these nerves can become pinched and irritated. And with the head shifted forward there, for every inch that your head shifts forward, the weight of your head doubles. See, folks, your head's like the weight of a bowling ball. It's like 10, 12 pounds or so. For every inch it's gone forward there, the weight of the head doubles. So now the neck and upper back area have to carry 20 plus pounds, and what that does is cause tremendous strain to the shoulders, the neck, upper back area. It compresses the spine as well, compressing the nerves, and in severe cases causes the disc to actually herniate. The disc will herniate, and sometimes we can see patients that have reverse curves in the neck there as well. And when this happens, and the neck is straight, and you have a reverse curve to your neck, the spine will actually start to decay and degenerate. And that's what it looks like here, is this model here. Here's a normal spine like this. You can see the disc spaces are nice and thick there. The bones of vertebra look healthy. When you lost that curve, you lose that curve, and it starts to shift forward there, and spine starts to shift out of alignment. If that's not corrected, scar tissue will form. The spine will actually decay. It'll degenerate over a period of time. And this degenerative model here shows that. So here's normal. Here's what's called a phase 1, where you lose some of the curve there. pressures on the discs and the nerves causing pain. This is a phase 2. The spine starts to decay even more and eventually goes to a phase 3. If you look at the disc there, there's normal. That's what a healthy disc looks like. In phase 1, it gets dehydrated. Phase 2, it gets compressed even more into phase 2. Eventually phase 3, this is what a spine looks like. And you got these bone spurs in a phase 3 that starts to fuse together there. In a phase 3, the whole thing starts to fuse together. So our spinal rejuvenation therapy helps prevent that further decay, degeneration, scar tissue from further forming your spine, and it corrects your problem there. In a few minutes, I'm going to go over our spinal rejuvenation therapy program.